In this video, we will start talking about the eye. And in the eye, there are the accessory structures and then the structure of the eye itself. For the accessory structure, we have the eyebrows and we have the eyelids. And basically, for both of them, their main function is protection. For the eyebrows, this is the hair of the eyebrows. It's basically like to protect against any sweat coming to the eye. Maybe if there are sand in the atmosphere, it will be catched by the eyebrows. Then in the eyelids, also it will serve a very similar function, that is also protecting the eye. Those are involuntarily, they will close to keep the eye wet from inside. And we know also that the eyelids are connected, or from them there are the eyelashes, also for the same purpose, to catch any debris that might come to the eye. Then another accessory structure of the eye, although invisible, is something called the conjunctiva. And the conjunctiva is transparent mucous membrane that is covering the cornea. So it is like above the cornea. And again, it's also for protection. It's also to keep the eye wet so it doesn't dry. In mucus in general, we will see it through the course. We will see it in several places through the body. It's also for protection. Now, this conjunctiva, it goes even inside the eyelid. So here in this area, like beneath the eyelid or in the hidden area, and here in the hidden area, there is also still this conjunctiva membrane. Then another accessory structure of the eye is something called the lacrimal apparatus. And this is technically the one responsible for producing tears. And the tears are important because they will keep the eye wet. They will wash any debris that attach to the conjunctiva. So we are constantly producing them, and therefore we are constantly cleaning our eyes. The structures of the lacrimal apparatus is the lacrimal gland. Those are exocrine glands that they will produce those tears. Tears will go up over the conjunctiva. They will wash the eye. Then the tears will get drained through the lacrimal puncta, which are little holes that will open to lacrimal ducts, into the lacrimal sac, and into the nasolacrimal duct. The nasolacrimal duct will technically open to the back of the mouth, and that's why sometimes we taste the tears, or if you have eye drops, that you will taste them at the back of your mouth. In certain instances, those lacrimal puncta, those sometimes will be closed, and then the ophthalmologist would go and open them, drill those holes to open them, and therefore allow that normal drainage of the tears. Then, a group of important accessory structures around the eye are the extraocular muscles. Those are 6 muscles that are inserted on the eyeball, and those are responsible for the movement of the eyeball. We have 4 rectus muscles. Depending on their position from the eyeball, we have the superior rectus, inferior rectus, lateral rectus, and medial rectus. And those rectus muscles, they will move the eyeball into their direction. So the lateral rectus will move the eyeball to the lateral side. Medial rectus will move the eyeball to the medial side, superior to above, and the inferior rectus will move the eyeball down. So those are easy to remember because their movement is their name. Lateral rectus, it means it will take the eyeball toward outside or laterally. Then we have 2 oblique muscles. Oblique muscles because they are attached to the eyeball with an angle. So this is the inferior oblique, and here at the back there is the superior oblique, or this is the one here, superior oblique. Also we can see it from here. This is the superior oblique, as you can see, because it's attached to the eyeball with an angle. So this is the superior oblique. And for the superior and the inferior obliques, those are producing 2 movements. The rectus muscles are producing just one movement, but the oblique muscles are producing, each one of them is producing 2 movements. And those movements, part of the movement is opposite to the name. So for the superior oblique, it will depress the eyeball. The superior oblique, it will move the eyeball down, and it will turn it medially. So when we want to look down and medially, that is the action of the superior oblique muscle. However, the inferior oblique will turn the eyeball up and laterally. So it will take it outside and up. So that is the action of the inferior oblique. So those two muscles, sometimes they are confusing in their movement. Just remember that the superior obliques and the inferior obliques muscles, those will act against their direction. So the superior will take it down, the inferior will take it up. The superior will take it inside, the inferior will take it outside. Whereas the rectus muscles, they will go by their names. If you remember from EB1, we talked about the cranial nerves, and we said we have 3 cranial nerves that are controlling the eye movement. So those cranial nerves are technically controlling those 6 extraocular muscles of the eye. So what is the clinical application of knowing, or why do we need to know those muscles? Because sometimes those muscles or the eyeballs are not moving in coordination, and that is what we usually call it the lazy eye. So you will see in those patients that, for example, those patients can turn both of their eyes to the right, but if they want to turn them to the left, one of the eye will get stuck to the right position, so it doesn't move along with the other eye. So in this case, those patients will see double vision, or their vision field is double. This is a situation called diplopia. So that is when the patient will see everything twice because there is no overlap in the field. And sometimes the treatment is just cover the good eye and let the lazy eye work harder to strengthen the muscle. Sometimes they have to go to do a surgery to release. Sometimes, like, some of the tendons are stuck in certain way, so they have to release them through a surgery, so the eye would restore its ability to move freely and to have this coordination between the two eyes.